Hello. There were a few questions that weren't answered, that we didn't have time to answer during the presentation. And so I am going to go over them now. I'll read the question and then I'll provide an answer. The first question was an interesting one. From your criteria, without going into politics or opinion, would you say that Joe Biden has dementia after observing that he has trouble to speak and sometimes forgets what he is saying? You know, I've been asked that question quite a few times, but it's difficult and probably irresponsible to try to make a diagnosis from news clips and what we see on video or read in the newspaper. What I would suggest is that you watch the upcoming debates, presidential debates, because people with full-blown dementia really will find it very, very difficult to respond to the challenges of a debate. And then you can come to your own conclusion on that. Question number 2, just my thought. I think it's quite a challenge to wheel patients or residents to and from these places, such as a dining room or activity room, while observing the 6 feet apart social distancing. I agree, even under ordinary circumstances, helping everybody get to the dining room on time is really a challenge. So perhaps they should have 3 or 4 seatings, which would mean that the dining room would be only 1/4 full at each seating. Now that would really stress the very small staff that they have in most nursing homes. But we have to be creative, and I think that's a really good question. And I think it's, there are probably some other solutions to that. Or people can take turns getting to go to the dining room and perhaps go once a day and then eat in their rooms the other times of day. It would be a chance to get out of the room and to see other people. Third question, they could create plexi shields for each person, like they're doing in schools with kids. Another creative idea. And honestly, I don't know if the plexiglass shields are sufficient protection for people as vulnerable as nursing home residents. That would be something I'd have to do some research on. I also know that it's very likely that people with dementia would have some trouble with having that shield around them, be something they're really not used to, and it might be something they'd be tapping on or trying to get around. But I think it would be worth testing them first on whether or not they're tolerable for people with dementia. And then secondly, will they provide enough protection from the potential for infection? So thank you, everybody. It's been my pleasure talking with you. Bye-bye.